Hi, welcome to the February edition of Queen City Skin Podcast. This month is Black History Month, and so in honor of that, I'm going to be talking about hair disorders that are very common in African American hair. We certainly see a lot of that here, and we thought we'd find an interactive audience that would enjoy talking about it. We have a few guests. Today, I have one of my patients who I have successfully treated with a scarring type of hair loss, and we got to chat with her on the phone. And as a special guest, we have Dr. Amy McMichael, whom I chatted with. Dr. McMichael's an expert on hair disorders. Start out talking about menu of this week and what I've fixed just to lighten the mood here. I made a carrot and parsnip soup, and carrots are rich in vitamin A and vitamin C. Vitamin's important for hair growth. And if you come in for a hair loss or hair growth consultation, we will discuss some nutrition. And I also made a smoked salmon and spinach quiche. And spinach is loaded with vitamin C and vitamin A as well. And then the eggs and the smoked salmon are also loaded with vitamins important for hair growth. In regards to the carrot and parsnip soup, I took probably 6 carrots and grated them and chopped them. And then a parsnip is like a white or light brown carrot, a little more tart or spicy. And those are grated. Chop them, put them in the oven. I roasted them. And then in a pan, I sauteed the green part of leeks in some garlic infused olive oil. I have a kind of a digestive disorder. I'm not supposed to eat garlic or onion, if you can imagine. It's really quite dreadful. But I've learned how to cook carrots because carrots are approved on this diet, and they're really lovely and loaded with nutrition, and including nutrition for your hair. And I've also learned to cook leeks because the green part of leeks and the green part of green onions is allowed in my diet. So sauteed those, but be careful. They turn black quickly. You have to saute them really low. And then while your carrots and parsnips are roasting, when they're all done, you dump those in and then throw in some chicken broth. And I used one of the immersion blenders to blend it all up. Probably some salt and pepper. And I think I also put this little mix of spices that I think I got in France, but it's got like a little nutmeg in it. Very delicious and very nutritious, low calorie, but filling, and just great all year round, but particularly during the winter. So that was my skill this week. Which was very wonderful. But we do discuss nutrition. We talk about hair loss. But hair loss in African-American hair, one of the most common things we see is a condition called seborrheic dermatitis. And this manifests as dry, flaky scalp, flaky around the edges. It may look like an oily scalp or an oily flake, kind of yellow, itchy, very common in African-American hair, but particularly more common in women who may not wash their hair as frequently. African-American styles often do not accommodate very frequent washing, and African-American or curly type hair is susceptible to breakage, and over styling can lead to breakage. So many women don't wash their hair that frequently. You can use certain shampoos and conditioners designed to treat seborrheic dermatitis, like Head & Shoulders, and Selsun Blue shampoo, and there's also special conditioners and oils. We actually do recommend more frequent shampooing if you're not shampooing, but only once every 2 weeks. And we'll try to recommend more frequent shampooing. And our conversation with Dr. Amy McMichael asked her for some tips, and those will be shared as we discuss those both on styling as well as shampooing. Some great tips there. Another thing that affects kind of the lifestyle of African-American women and their hairstyle is exercise. A lot of women, although I think this is Caucasian too, because I'll skip a workout to avoid styling and shampooing my hair because I put it up in a ponytail or it gets wet from sweat and messed up. Well, this is particularly problem for African-American women who may just style their hair once a week or once every 2 weeks, and a vigorous workout might ruin that hair. And so as physicians, we try to find ways for our patients to have helpful hairstyles, whether it be natural or a natural braid, so that they can participate in exercise without ruining their hairstyle. over styling, heat, and chemicals such as flat irons and straightening can lead to breakage, particularly in African American hair because it's curly and the curls do not hold or wick oil very well down the hair follicle and is very much prone to breakage. So in a consultation with African American women, we look at the scalp. We look for conditions like seborrheic dermatitis. We look for breakage. We talk about exercise and hair styling and try to find ways that we can improve both the scalp as well as the health of the hair evaluation. Other things that lead to hair breakage include tight braids and even tight ponytails. So looking for a more loose braid or twist and keeping a loose ponytail are some of the things that we might suggest for that. All these things are very common, but they're very important to discuss with our patient population so they have success with lifestyle changes as well as hairstyle changes. And any hair loss associated with these is reversible and manageable. What we want to do in an evaluation is look for hair loss that might be irreversible, i.e. not growing back. And these are called scarring type hair losses or alopecia. By the way, I didn't introduce alopecia. Alopecia just simply means hair loss. If you're diagnosed with alopecia, it doesn't really mean a whole lot. We define what type of alopecia. Alopecia just means hair loss. So we'll show you our conversation with Miss Devin Pittman, who was a patient here several years ago when I identified in her a scarring type of hair loss that unfortunately is very common in the African American population called central centrifugal cicatricial alopecia. So central meaning the middle of the scalp. Centrifugal meaning like in a circle, going out from a circle. So it often starts in the very middle of the scalp and moves outward like you're slinging a rock on the end of a rope. It just keeps moving outward and outward. Cicatricial means scarring, and that's the critical point. And that's why we want to diagnose these things very early because it's scarring. And once the hair follicle is lost to a scar tissue formation process, we can't get it back. We want to catch it early and intervene and treat aggressively so we end the cicatricial cycle. So central centrifugal cicatricial alopecia, or CCCA. It used to be called hot comb alopecia because it was thought that the combination of chemicals with hot comb styling triggered inflammation down the hair follicle that caused this condition, caused inflammation and loss of the hair follicles and the scarring. What we know now is that those hair styling techniques probably play a role, and a big role. And if you were diagnosed with this, we'll discuss changing hairstyling techniques, moving away from too much heat, moving away from the chemicals and the traction. But there's other factors that play a role, including genetics. And it's even been associated with type 2 diabetes. So if you come in and we diagnose you with central centrifugal cicatricial alopecia, what do? Well, we talk a lot about changing hairstyle techniques and probably moving to a more natural type of styling. So we're avoiding heat and avoiding chemicals. We will often treat with intralesional injections. That means little shots in the area that are affected, and we inject steroid. I'll send you home with prescriptions, including oral antibiotic and topical steroids, all designed to stop the inflammation that's causing the hair loss. And we will act quickly and aggressively and see you even at 2-week intervals so we get this under control. And that's the CCCA. And the message is, if you think that you're experiencing some hair loss, come get it evaluated. Because if it is a scarring type hair loss, we want to intervene as quickly as possible to stop the process. Another common process in African American hair is traction alopecia. And traction, 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 is the hair loss that occurs from tight ponytails or tight braiding or even tight clips. Traction There's something about the susceptibility of the hair follicle where it is pulled on consistently and for a consistent amount of time. It can lead to hair loss. That's often visualized around the hair framing the face. So just around the forehead and the temples, because that's where the braids come in and they pull. We will sometimes do a biopsy to prove this diagnosis. But again, the treatment here is quickly changing the hairstyle. So we remove the traction. Unfortunately, traction alopecia or traction hair loss can be scarring. And the scarring means permanent. So again, early intervention is key there. Lastly, there's some hair loss that is kind of common in both Caucasians as well as African Americans. And one of them is called frontal fibrosing, which is a type of hair loss that also happens in the front of the scalp. And that can cause scarring too. So we want early intervention. And another one is just plain old genetic female pattern thinning, which is not scarring, but that's kind of an age-related decline in the density of the hair, typically in the bitemporal areas, as well as the top of the scalp. And those are treated with common over-the-counter as well as in-office treatments, procedures such as laser treatment and platelet-rich plasma injections. We're also offering at Charlotte Skin and Laser a new scalp treatment that's much like a facial. Like you come in and get a facial for pore cleansing, but for your scalp. It's called hydrocleansing of the scalp. And so I mentioned the seborrheic dermatitis. It's real common in African American hairstyles and difficult to control because it's thick hair and hard to get the treatments down on the scalp. Hydrofacial for the scalp is our regular hydrofacial. It uses pressurized and suction water to cleanse, to deeply cleanse, or remove that adherent, itchy, dry scale on the scalp. And we can also use it to infuse moisturizer. So it really, in cases where we can't bring the scaly, itchy scalp under control with the regular medications, we might recommend the hydrofacial for the scalp. Very, very helpful condition. Very helpful to treat for the seborrheic dermatitis. So that's about all I had for hair. But the message is, if you feel like you are thinning, or if you've noticed it in a friend, or your hairdresser may have said something, come in early and get evaluation. There is treatment. There is hope. Can intervene. And that's what we're dedicated to doing here at Charlotte Skin and Laser, and why we produce this podcast today to talk about hair loss, particularly in the African American population, and where we can intervene. We'll show you the clip of me chatting with one of my favorite local dermatologists, Dr. Amy McMichael. Dr. McMichael is a board-certified dermatologist, and she's a professor in the dermatology department at Wake Forest School of Medicine. She's previously been a chair of the department. I've known her for years, ever since I was in training, which was a long time ago at this point, and have worked with her a little bit and always respected her. And any opportunity I have to hear a lecture or a talk from her, I try to take that opportunity. She has published numerous scientific papers on hair loss and hair conditions in men, women, children, and African American. She's also published on acne, psoriasis, keloids, and has a number of papers on the care of skin of color, and also equity and cultural competence in medicine as well as in dermatology. So well-rounded and very knowledgeable. She has been a teacher and a mentor and a savior for many of her students, physicians, and patients. I know she's very well respected and very well known. So let's get to the clip with my chat with Dr. Amy McMichael. So what I'm trying to do with this podcast this time is talk about some of the common things of hair loss in African American women.
Okay.
And what do you think are some of the most common issues of hair in African American women, or what do you see the most?
So I see uh, many things. I'll just start talking about some of the more concerning ones. The two most concerning ones, I think, are traction alopecia and central centrifugal scarring alopecia, or central centrifugal cicatricial alopecia, also known as CCCA. So those are probably the two most devastating, because once they get to a point where the follicles are damaged, you really can't help, that much in terms of follicular rescue or allowing the hair to regrow. But I also see a significant amount of hair fragility in my African American women.
Me
And that,
too.
yeah, so of course, we understand that there is some genetic basis to that. We don't quite know where it comes from or what codes for it, but there's an underlying, as yet unexplained, fragility that causes significant breakage, and so that's a big concern.
Yeah. What are your tips on helping breakage? I mean, I know my patients would love any tips.
Yeah,
And I
well,
like to keep up as well.
yeah. So I like to tell my patients to minimize chemicals and heat, because those two things, plus the innate fragility, are going to be the most likely to cause, sort of catastrophic damage to the hair shaft. So you really have to pause the color, potentially pause chemical relaxers, and the heat. And sometimes people can't do all of those things. Sometimes they have to do one or the other. But if they can do all, then that's great. Trimming the hair, sometimes it's very difficult to explain to people that you want them to trim the hair, because they, of course, want it to grow. But of course, you have to cut the damaged hair. And then also the hair care products. People are really into natural. I got to get something natural. And you can better and avoid this, avoid that. And the problem with it is that when they start taking out sulfates and parabens, they put other things in that oftentimes can be worse. So I try to encourage them to use products that are made for people with coarse curly hair, made for people of color, women of color, and also to minimize oils, because they just coat the hair. They don't really moisturize there. So you need a moisturizing shampoo, a moisturizing conditioner, one with heavy moisturizers, because moisturizing components, humectants and that sort of thing, work differently than oils. They don't just coat the hair. They may have that component. There may be silicone coating agents in the products, but it goes deeper than that. There's more conditioning to the actual hair shaft. So I encourage them to not have this sort of deal with, they have to do natural. And another thing is that, a lot of these products that are natural oils will also start to cause acne or eruptions in the face. And we get in, to irritant and scalp, that sort of thing. So I mean, I have, like a number of products that I cycle through, and they change from time to time, year to year, when I find new recommendations. So I can't say that I have a go-to that fixes it all, but I do have a number of products that I'll try to recommend them, for their budget. So not everybody wants to go and buy something from a salon. Some people want things that are more reasonably priced. So I try to do that. And I always have my patients wash their hair, if they can, with every 1 to 2 weeks, because the shampoos and conditioners, first of all, it's great for the scalp. And so for my sebderm patients, which is another huge problem with my African American women, that helps, especially if they're using a anti-dandruff component to the scalp, directly to the scalp. Usually it's zinc. I usually don't do ketoconazole, it's usually zinc. And so, if they do that to the scalp, and then they're moisturizing shampoos and conditioners to the hair shafts, that works really well. And so you're using your anti-dandruff shampoo as a treatment, not as a shampoo for the hair. And then follow up with some leave-on conditioner. And potentially you could finish it off with a little oil or something like that, just at the ends or something. But
as long as you've got that conditioner on there.
Yeah, the conditioner, and then the leave-on conditioner, and then maybe a little oil at that point.
What's your favorite leave-on conditioner?
Well, I go with a lot of different ones. I like if people aren't very sensitive to fragrance, I like the Pantene Gold product. I do work with the Procter & Gamble group. Sometimes I have to just let that out as a disclosure. But I also like one I don't have anything to do with, and it's Design Essentials, avocado and almond. I like that a lot. And then the other product that I really like, and it's not specifically made for women of color, but is the Olaplex series. So they have the conditioner, like
that was just recommended to me, actually.
yeah. So that could be very nice for patients of color as well. So I like those, and then there are probably a few others, but those are probably the key ones. Now, for my anti-dandruff, I do recommend the Keracara Dry and Itchy, Kericara, Dry and Itchy. And then I recommend, if they don't have issues with fragrance, the Royal Oils, which is another Procter & Gamble product. Royal Oils Head and Shoulders. I think those are good. So, recommend not scratching up the scales if you have sebderm, because that can make it worse. A lot of times people don't recognize that. But my point about the shampooing more frequently, even with hair shaft fragility, people think, well, that's going to make it more fragile because then I'm going to have to do it more often. And so it is always a balance. But the conditioner and the shampoos, they don't work forever. So if you want to rock the month, the benefits of them have gone away probably within 3 or 4 days. So if you can, wash it and get the shampoo back on. And some people, the other thing they could do is there are some co-washes out there as well that can be very helpful too. So you don't have to use a shampoo each time. You can use a co-wash, which is, more conditioner than there is shampoo, of course.
Yeah. Do you get into another issue if you take away the heat and the chemical? Then maybe individuals go to braids or something where it might be a traction alopecia. How do you find the balance? Or
and it is always a balance. So nothing too tight, nothing that's left in for 6 weeks. So I recommend loose braids and crochet. That you can still get into your scalp and wash it and treat it and that sort of thing. So that's one of my favorites. Certainly you could use wigs too. Partial wig, full wig, to give yourself a little bit of a break. It's sometimes difficult in the summer, but that's, you can move to a crochet. Some people just, decide to start all over again. So they cut the hair very short and they allow it to be natural. But I agree, there's always a balance to how much you have to do to get your hair in the form that you like it, versus treating it, and treating it very, gently. So there is a balance, and it's not the same for every person.
Agreed. One issue that I run into with my patients sometimes is their hairstyle and exercise. Any tips on helping women of color keep their hairstyle but still enable them to exercise and do the healthy things in their life they want to do?
Right. Well, we wrote a paper about that some years ago.
I know you did.
A long time ago now, but yeah. So we looked into this and we, asked our patients who were exercisers. We did kind of a group of women that just come one, come all, and then we did a group of women that were actually exercising, and they were a little bit on the older side. They were a group that were involved in a study, looking at exercise in women over 60 or something like that. But still, they were exercising, and so what we found was, ponytails were very popular, braids were very popular, and again, not tight ponytails, not tight braids, that sort of thing. People like to wear their hair in a bonnet, although I'm not a huge fan of a bonnet, but I do like this this thing called a slap cap, and I have no association with this person or this thing. And it's a silk lined or satin lined cap that's very soft, and it doesn't have that elastic in it like the bonnets do. So some people will wear that while they're exercising, or they wear it at night after exercising, and it allows their hair to just stay in the style. But if you're a very big sweater, that none of this is going to work. You're just going to have to figure out a way to do your more light exercises right after you wash your hair. So do your stretches, your walking, and then as you get closer to when you're going to wash your hair, you can do your more high impact, Peloton, where you break it out and just go for it. Because there's really not anything that we can do unless, again, you can wear your hair naturally. One of the things I tell my patients who have a little bit longer hair, people with shorter hair can do it too, but you can't do it if your hair is too short, is to try to minimize the heat by using one of the new airbrush stylers. Again, I'm not associated with any of those companies. I don't have one. but they allow you to get a really nice blowout from just the dryer, and you don't have to put the heat in the hair. So sometimes it's
So
enough.
like a heatless blow dryer.
Yeah, but it is not heatless. I mean, there's heat to it, but you don't have to curling iron in.
Okay.
Because a lot of times, the way that the hair is processed is that you wash it, you blow it dry, then you use a flat iron or a curling iron to get the desired look. And this allows you to try to get one heat, step.
That's what I do with my hair.
Mm-hmm.
It's because I'm not coordinated.
Yeah.
Well, you mentioned earlier, what sounded like definitely a priority for you, and it is for me too, is the CCCA and the traction. And I bet it's because you want to grab these patients before they've had too much loss.
Right. And we're looking at a large group of patients. We haven't gotten this study published yet. We looked at 100 of our patients, and we found that really a lot of the treatments that we do slow down their progress. So that's encouraging. But the problem is, we were looking at pretty much people from there's a way you can sort of separate out the levels of disease. And this is a scale that Elise Olson and a number of us helped to complete. And if you're on the low end of the scale, it kind of works. But if you're on the high end of the scale, if you present with very severe disease, we're not going to probably recruit. But what's interesting is that occasionally you can. And so there is some ability to recruit hair follicles that maybe that aren't completely damaged. So I usually do try, at least with topical medications, maybe an oral medication such as Doxy, to try to see what we can get. And then we'll go into more advanced treatments if needed. We do intralesionals, usually a series of about 8 intralesionals separated by 6 to 8 weeks, and intralesional Kenalog. And then we do a topical series, usually high potency, a few times a week. Minimize traction, obviously, use anti-dandruff shampoo if needed. And then we are actually looking at our PRP patients. We've had a number of PRP patients with CCCA, and we do see some early looks at the study show some improvement. So we're still at the early days of that, but
now when you use a PRP intervention with CCCA, is it important that you've got the inflammation under control, or can you treat the inflammation and the stimulation at the same time?
I don't think I know enough about that to say. So what we do, I'm sure this is not uniform, but what we do is we usually wait till we've given them either a systemic antibiotic for 6 months or more, or done the intralesionals, the topicals for 6 months. One, of course, if they're on the antibiotic, they're on topicals as well. So we usually, it's usually 8-9 months into treatment. But do I know that that's what's needed? No, I don't know.
Yeah,
I can't.
exactly.
I haven't done that research, so I don't know.
Well, you're truly an inspiration. I appreciate you sharing these thoughts. I don't want to keep you any longer on a Sunday afternoon, because I can assure you, I could talk to you forever.
I could talk to you too. I just unfortunately overbooked myself with, I got so excited about my little mentee being in town.
Well, I'm sure you're a mentor to many, including myself. I never miss a lecture for sure. I always learn something, and including this afternoon. Well, enjoy the rest of your afternoon.
Thank you. It's great to talk to you.
Good to talk to you. Bye.
Bye-bye.
Well, that was a wonderful chat with Dr. McMichael and full of some helpful information. We talked a lot, and you could hear us chatting about the importance of catching things early and coming in for treatment early, because there is hope and we can really intervene. The next talk I'll share with you is a conversation I had with a dear patient of mine, Devin Pittman. She's been a patient of mine for years, but she came to see me several years ago because she thought she was losing hair. And indeed, we diagnosed hair loss on her, which was central centrifugal cicatricial alopecia, or CCCA, and started treatment. But unfortunately, by the time she presented to me, she already had a lot of hair loss and some scarring up in this area of her scalp. But once we got it under control and rescued what we could of her hair and felt confident about that, I said to Devin, if you're interested, go see Dr. Jerry Cooley here in Charlotte, talk to him about hair transplantation. And she did. And she just got a fantastic result. It's a real success story, both in catching it, getting some medical treatment, and then following up with that medical treatment with a cosmetic treatment that just really brought back her confidence. Devin is outgoing and smart and personable and fun, and the hair loss really had her down. It's just great to see her back to her old self. Just love her, and hope you enjoy my conversation with Devin. Hey, Devin.
Hello, Dr. Austin.
I hope you're great.
I am. I'm doing well. How about you?
I'm doing well. I hate I'm not seeing you in person, but it's great to hear and look at you.
Yeah.
So look at you. So what we were doing this month, Devin, is doing a podcast on hair disorders that predominantly affect African-American women, or more predominantly affect African-American women, and just educating our listeners about them so that if they have the hair condition themselves or know someone or a family member, they at least know there's some help for that. And so I was looking back at your chart, and it looked like around 2019 sometime, you came in with your eczema. God bless you. I hope that's under control right now, right?
For the most part, yeah.
Good. And then some hair loss. And what we diagnosed you with is that crazy condition, central centripetal cicatricial alopecia. Do you remember that time when you were having that hair loss?
It's weird. It's funny because now I'm super paranoid about it, because to me, I feel like I just woke up one day and it was gone. But I guess now when I, just as a part of going through life and I'm looking at pictures and stuff, I can see the progression of it subtly. And I just didn't notice and pay attention to it until it was as pronounced as it was by the time I came to you for help.
I totally understand. So with me, I will sometimes look back at photos of my patients, and it's just like this slow change, and it looks normal, and it seems to hit this tipping point where I notice it or the patient notices it, and we're like, wow, there's a lot of hair loss there. It kind of sneaks up on you, doesn't it?
It does. So like now I'm super paranoid. I've actually made an appointment to, with Dr. Cooley to try to, at least do like some monitoring and oversight. So just in case I have my blinders on again, if it's something that, because I think my understanding was it's something that had it been caught early enough, maybe it could have been minimized or.
Yeah, that's exactly right, Devin. The hair loss that you had is a scarring type hair loss. That's what that crazy word cicatricial means, is that it's scarring. And so when we saw you, my number one priority with you, if you recall, was, oh my gosh, let's get this under control. So we sent you home with topicals, and we did those injections, and you worked hard and we worked hard. And what we managed to do is to stop the progression,
right,
which is great. But unfortunately, you had an area of scarring in the middle of your scalp that we couldn't fix because the hair follicles were gone. So we rescued what we could, you and I together, and then I sent you to Dr. Cooley for hair transplant, which in my opinion was transformative for you. I just love it.
It was. I mean, because not only did I have the condition in the crown of my head, which I've probably had for many years. I remember one of my hairstylists mentioning it to me many, many moons ago, and I just didn't think anything of it, and just attributed it to potentially, some styling error, the time I was getting my hair relaxed, chemically relaxed. And now, I've switched over to letting it grow natural, letting all the chemical grow out. So I just attributed it to something like that. But by the time I got to Dr. Cooley, and luckily because of the work that you and I had done previously, he was able to confirm that, because he would not have even considered doing the transplant had I still been going through the inflammation and all that stuff was still prevalent during that time. It would have been no point.
Absolutely.
So the work that
inflammation under.
So the work that you and I had done, you know, had really teed me up really well to be able to hit the ground running with him. You know, he did the actual, biopsy to confirm that it was what we thought it was, the
Good.
scarring alopecia. So, you know, and then, like you said, it was like he gave me kind of like a little minor grace period to say, hey, let's make sure it's under control, the inflammation, and this is not still spreading. And from there, I scheduled the procedure, and initially it was very intimidating, not only just kind of personally as a woman, financially, and all these other little things, going on, but now I wouldn't change it for the world and would do it 10 times over if I need to.
Yeah, I wouldn't change it for you either. I think it looks great. What advice would you give women that maybe think they're seeing a little hair loss up there or concerned about it? You've been through it. What's your message to them?
Don't ignore it.
Mm-hmm.
And I guess for me, from my perspective, to be a little more attentive, to that type of thing. And now I'm probably over attentive, but, it's kind of one of those things that, and I'm kind of that way too. Typically I'm just like, oh, it'll fix itself, kind of thing, or, oh, it's not that serious with just things in general. You try to give things a grace period. But with this particular condition, the sooner, the better, the more options you have that, especially if, you're looking for something that's more cost, more at a price point to where, you don't want to have to, get to the point to where you need, basically, that was my only option, to do the hair transplant, to get hair back, to get my confidence back. Like I tell people, to get my kind of female swag back and feel like me again, and hairstyles and just, all that just in general. That was my only option. So there are, opportunities to catch it beforehand and to, stop it from becoming worse. And even potentially, from what I understand, you're able to actually, start to regrow hair in some cases as well.
Absolutely. That's why we like to catch it early. And I'm glad to see that you have your swag back. I've always loved Devin's swag. She just can rock it, and she's beautiful. And so,
well,
yes,
you.
When I saw that hair loss, I knew I was going to attack it full frontal. We, of course, are happy to see you and follow up and help you. I know you want to follow up with Dr. Cooley about the hair transplant. I'm confident that we can take good care of you.
And, no, it's going to be a two-pronged approach. It's definitely going to be, because I feel like, there's maintenance that you and I can do. And I actually have an appointment already on the books for you, because it's just something I want to, like now, the slightest little tingle I feel, and things that like I said, I ignored in the past, when your scalp may feel a little, I don't know, a little tender, and in our culture, we call it tender-headed. Oh, you're just a little tender-headed. But no, now at this point, there's something else going on that can lead to, hair loss that you don't want or have to have. So now when I feel like I can feel that my scalp is a little tender-headed, that's the kind of things that I would like to continue to work with you on, to do the treatments we were doing prior to getting to the transplant point, to kind of help, mitigate that.
Absolutely. Well, thank you for sharing your experience with us. This is why I wanted you to join us on the podcast, because you have such a good mojo and swag and confidence, and you stuck with the treatment plan and got some success. So I'm really proud of you, and I'm delighted to catch up with you. I'm glad to see you're just as beautiful as ever.
Awesome. Well, thank you, Dr. Ross. And I was flattered 2020. That you remembered me. I was telling Amanda,
kidding me?
I was flattered. I was like, what? So yeah, I'm flattered that you remember me, and anything I can do to help anyone else not go through this, there's, I had to tell myself there's no shame to it. The quicker you get it taken care of, the less, interference you have to worry about with your life, and, that kind of thing. So
good. Well, I can't wait to catch up with you in person, my dear.
Yes, ma'am. You will
Thank you for taking the time.
Bye, Thank you, Dr. Austin. Have a good day.
Well, that's all we have for our podcast today. We've covered a lot in hair loss. We've talked to a hair loss expert we're so blessed to have in our state. And we've talked to a patient who's undergone successful treatment. all the way to the end to hair regrowth through medical treatments as well as cosmetic treatment. And the message of today is if you think you're having some hair loss, get in early, come see us, get some treatment, and let's get on top of it and start your hair treatment right now. Let's treat the condition and work on growing hair for you. That's all we have this week. And try that carrot soup too.